Let me overview about the conjunctivitis. Conjunctivitis, also known as pink eye, is the inflammation of conjunctiva. So in this picture, this area, white one is conjunctiva. So when inflammation or infection of the transparent membrane called conjunctiva that lines our eyelid and cover the white part of the eyeball. The white of eye appear reddening or pink when the small blood vessels in the conjunctiva become inflamed. So, conjunctivitis may be caused by allergy, infection, or trauma. Infection may be by viral or bacterial allergies, or even non-allergic like trauma. And conjunctivitis, particularly bacterial or viral, it's extremely contagious. What are the common data regardless of type of conjunctivitis? Patient complain itching, blurring of vision, or itching the eyelid. Redness of conjunctiva or sclera is common, edema, and redness. Chlamydial conjunctivitis is very uncommon among older children. If the diagnosed in a children who is not sexually active, he or she should be assessed for possible sexual assault or sexual abuse. So neonate has a conjunctivitis we call neonatal conjunctivitis. Maybe this baby is got it from mother and during the delivery it is transmitted. Here we see different types and different cause of conjunctivitis. As I told you, conjunctivitis may be caused by the viral. So viral conjunctivitis causes usually by adenovirus type 3 or coccivirus or herpes simplex viruses. So viral conjunctivitis associated with cold and upper respiratory tract infection. Also, patient complain the sore throat and it is highly contagious and spread through direct or indirect contact of eye secretion. The bacterial conjunctivitis caused by Staphylococcus or Streptococcus bacteria, Haemophilus influenza, or Pseudomonas. Even Neisseria gonorrhea can cause conjunctivitis. In this picture, we can see the pus produced by bacteria. This picture, allergies can cause conjunctivitis. Allergies response to an allergy causing substance like cosmetics or some pollen. Histamine is released and lead to redness and pink color of the eye. Immunoglobulin E, mast cell hypersensitivity reaction also can occur. And non-allergic conjunctivitis usually reaction to any mechanical or chemical substances. And what are the risks of getting the pink eye increase with? So next here, the bacterial conjunctivitis, the patient if exposed to someone infected, then it will be contaminated. Rubbing the eye or contact lens can cause bacterial. Allergic, exposed to something you are allergic to, such as pollen, grasses, wheat. Sometimes chemical substance exposed to irritation, chemical substance can cause conjunctivitis. Use of contact lenses also another source of conjunctivitis. So regardless the type of conjunctivitis, the common sign symptom we found marked or diffuse redness. You see the picture, redness, inflamed, watery, or purulent discharge. In case of viral conjunctivitis, conjunctival injection, infection, or edema formation, watery discharge. Bacterial one is sudden onset, sometimes mucopurulent or purulent discharge, like this picture. And swollen the eyelid. This is the common sign and symptoms of conjunctivitis. If patient complain the allergic conjunctivitis, the hallmark sign is the itching, tearing, nasal congestion, or mucoid eye discharge. So, as a healthcare provider, how we take care of the patient, right? So, intervention. Keep this note, assessment, the visual acuity is the priorities, right? And then we go for complete eye examination. So reinforce instruction in infection control measures such as good hand washing and not sharing the towel or washing. Administer antibiotics or antiviral eye drops or and ointments. If the infection is present, means severe infection may require therapy with systemic antibiotics. If it is bacterial, usually the drug of choice is erythromycin ophthalmic ointment or azithromycin BID 2 days, then daily. Also, bacitracin ophthalmic ointment also very helpful. If the underlying cause of the viral, we give them symptomatic relief and also limited spread to others. Artificial tear is works, cold compression, antihistamine, and if it is viral, no antibiotic since virus is the origin. So if underlying cause of conjunctivitis is allergic, it should be self-limited or antihistamine can work like GTEC, Claritrin, or Allegra, what we can buy from over the counter. Also, re-educate instruction to the child and parents in administration of prescribed medication. Reinforce the instruction to the parents that the child should be kept home from school or daycare until antibiotics and or antibiotics eye drops have been administered for 24 hours. What else? So re-educate instruction to the child to avoid rubbing the eye to prevent the injuries. It is also important to educate to the child who is wearing contact lenses to discontinue wearing them until treatment is complete. New lenses must be obtained to eliminate the chance of reinfection that can occur from use of old lenses. So also reinforce instruction to the adolescents that the eye makeup currently being used should be discarded and replaced with new makeup to prevent the reinfection.